This is as far as Dr. Joseph Finkler ventures these days. The ER doctor is in isolation after testing positive for COVID-19 last week.
I guess I felt a tiny bit invincible until I got this.
At first, he thought his fatigue came from working night shifts. He also thought he knew why his sense of smell disappeared, another coronavirus symptom.
You go into an emergency department, it's not like a perfume parlor. It's quite the opposite. It's more like a garbage dump. But we were wearing face masks. I thought, oh, that doesn't smell so bad in here as usual.
But when Finkler got night sweats and the shakes, he went to this testing site. 24 hours later, a positive diagnosis. He doesn't know how he contracted the virus. He was wearing protective gear, and so far, none of his colleagues at St. Paul's Hospital in Vancouver are showing any symptoms.
You won't find nobody without full gear. People are quite paranoid.
Because they know how fast the virus spreads and how deadly it can be. More than 60 doctors in Italy have already died.
For sure, protecting the health workforce is absolutely critical.
Federal public health officials say there is no national tally of infected doctors and nurses. That data comes from the provinces and territories. Today, Alberta confirmed 77 healthcare workers there are infected, and in the Windsor area, around 15. Most are Canadians working in Michigan. The Canadian Medical Association says it's hearing from doctors worried about the lack of personal protective equipment in some facilities.
We have to protect them before they go into this battle. And it is a battle, and their health and their lives are at risk.
As for Dr. Finkler, he believes his hospital has enough safety gear for now, but many more patients are expected to come through these doors. Briar Stewart, CBC News, Vancouver.